All right, we're now recording. Hello, everyone, and welcome to Understanding Technology. Today, March 24th, 2021. I am Aaron Angel, librarian here at the Florida Public Library, and today we're here to talk a little bit about vaccination websites. Ever since the vaccine came out a few months ago, people have been, of course, struggling to try to get appointments, to try to get vaccinated, to keep track of who's eligible and who's not eligible, and it's been a little hectic to say the least. So today we're going to try to tackle the technology side of that a little bit and take a look at some of the websites that are involved with this and just how to navigate them, what information is on there, and perhaps share some tips about the best ways to get yourself an appointment if you have not already been vaccinated or do not have an appointment. I will note for the record right now in the state of New York, as of this recording, the eligibility is anyone, I believe, over the age of 50, if I'm not mistaken. I think they dropped it to 50.
You're correct, Baron.
Yeah, anyone over the age of 50, also anybody with specific comorbidities, and there is a list of those, but things such as heart disease, kidney disease, obviously any respiratory illnesses, things like that. And also anybody who is works in pretty much any medical career, anybody who works in education, and many of the frontline workers, grocery store workers, pretty much anybody who interacts with the public for most of their day is generally eligible. And I'll show you where to find the more detailed list on the website here in just a moment. So we're going to start off with the New York State website, and we'll show how to navigate that and what's on there. And then we'll go to the Orange County website briefly, since that's a little more local to us, and show what they have. And then we'll take a look at least one pharmacy website, probably Walgreens, but we'll take a look at one because all the pharmacy websites kind of operate the same way, regardless of which pharmacy you're looking at, whether it's Walgreens or CVS or Rite Aid. So we'll look at one of those and see how that works. So let me go ahead and share my screen and we'll get started. Over here, that's what I want. Share. Okay. So this is, let me minimize this up and down away. There we go. Minimize now. There we go. So this is the New York State COVID-19 webpage. You can access it at covid19vaccine.health.ny.gov. And I will give that to you guys in the chat, and I will also put it in the description of this YouTube video if you're watching it in that format, so you'll be able to get the link down there if you need it.
Well, there's no dot in that. It's COVID, no dot 19.
Right, COVID-19 vaccine, and then .health.ny.gov.
Perfect.
I just put it down in the chat there if anybody wants to get a better look at it. And this is all of New York State's information on what's going on regarding COVID-19. Also, if you're anywhere on New York State's website, they have this nice update banner right at the top. It's kind of got a date and time, and it tells you what the most recent information is. And that is that COVID-19 is still spreading even as the vaccine is here. It's important everyone wear a mask, social distance, and stay up to date on what's going on with the vaccination program, of course. So that is where we are at currently.
So that's health.newyork.covid?
Health.newyork.gov.
Oh, gov.
Yeah. Anytime you're dealing with a government website, it almost always ends with .gov.
Okay.
That's just standard. It's a special, what they call a domain that was created specifically for government websites. So once you're on the website, here's what you've got here. Everything up here in this white bar, that's the overall government website. So don't worry about that right now. What's here in this blue bar, that's the COVID-19 stuff on this page, and that's what we're going to look at today. So first of all, right here on the main page, you can see there is the check eligibility to determine if you are currently eligible for a vaccine based on what the current regulations are, and also a vaccine tracker to see where the vaccine is available and which vaccines are being offered. And as you scroll down, you'll see that there is a general summary of the situation. Supply from federal government is limited. Additional New Yorkers become eligible as the supply increases. 12 million New Yorkers are currently eligible. This includes, and I mentioned some of them, doctors, nurses, healthcare workers, people over 50, first responders, teachers, transit workers, grocery store workers, public safety workers, and certain people with comorbidities and underlying conditions. These links right here are very useful. These are the fact sheets for all the different vaccines that are out there right now. There's the Pfizer vaccine, There's the Moderna, and there is the Johnson & Johnson, also known as Janssen. So you can read up on those vaccines, these specific details about what's in them, and how these side effects might fluctuate from one to another, and the time spacing between the different vaccines, things like that. For those that don't know, the Johnson & Johnson is a single-dose vaccine, whereas for the Pfizer and Moderna, you have to get one dose and then go back a number of weeks later for a second dose. In the case of the Pfizer vaccine, it's a 3-week wait. In the case of the Moderna, it's 4 weeks. And vaccines are available at a wide variety of locations: pharmacies, hospitals, local health departments, federal qualified health centers, a lot of different places. And when you look at the MI eligible, which we'll look at in a second, it will help you find out where those places are. This is another good website here, Vaccinefinder.org. That's a good way to try to find a vaccine outside of the state network. That would be to find pharmacies and things like that. Any state vaccination sites that are not directly being run by the state, you'll be able to find on that website as well. So that can be a good one if you're trying to look outside of anything being run by New York State directly. I believe that would also include anything being run by counties or local governments, if I'm not mistaken. And there's a nice checklist here of exactly who is eligible, the full list. And there's a list of specific instructions for how you would proceed with the New York State vaccination sites. First, step 1 is to determine your eligibility using the MI eligible page on the website or the app that can be downloaded. And that's the quickest way to see if you're eligible. You can also call the phone number right here. It's 1-833-NYS-4VAX or 1-833-697-4829. And they can basically do the same thing over the phone that you would do online if whoever is looking at someone that is not tech savvy or just feels more comfortable having someone else help them through it, which is completely understandable given that a lot of the eligible folks at this time are people who might be senior citizens, who might not be familiar with using computers or might have difficulty. That's something that is great for them, and I'll put that in the chat as well. Once that you have a confirmed appointment, you have to complete this New York State COVID-19 vaccine form. You can fill it out online and bring it with you. It makes it a lot easier, but there are also some sites where if you show up and you don't have it, they will have you fill it out in person. They prefer you have it already done because it saves time, but I've seen people fill it out at the sites in person as well, so there are ways around it. But if you can fill it out, bring it in advance, that's always better. And if you're watching this and you ever needed help printing this out and getting your forms together, please do feel free to come down here to the library. I or one of my coworkers are more than happy to help you get your documentation printed. We cannot help you fill it out. We don't deal with other people's personal information, but we can at least help you get the forms printed. So all you have to do is write down all your information. And you'll receive a submission ID indicating completion. There's also an option to do it online and just click submit. You can do that as well. And again, we can help you get to that page, and then you can enter your information. And you'll have to bring that confirmation to your appointment. That way they know that you did properly fill out all the paperwork. And you also need to bring your proof of eligibility, depending on the reason you're eligible. If it's simply by virtue of being over 50, your driver's license will be sufficient showing your age. If it's because you have a comorbidity, then you would need to have a letter from your doctor explaining the comorbidity and confirming that you do in fact have this particular ailment. If it's because of where you work, your particular career choice, then you would want to bring either an ID from that career choice or some other indication, either a letter from your boss or something that does indicate, hey, I work as a first responder or at a grocery store or what have you, and that would be your proof for that. Now, when you do sign up for the vaccine, it does ask for insurance information. You do not have to have insurance to get this. Either way, you will not be charged. What this amounts to is the government is basically saying, if you have insurance, insurance companies have money. We'll take money from insurance companies. But if you don't have insurance, that's okay. We just won't charge anybody. Either way, you as an individual will never pay for the vaccine. And If you receive the Pfizer and the Moderna vaccine, they will automatically schedule your second appointment after you are finished with the first one. They will give you a little card that shows that you have received the vaccine. It'll have the date, it'll have your name and date of birth on it, and either written information or a little sticker that says what vaccine you received with a lot number and information about the dose. And they will schedule your second appointment to come back and get your second dose. And then they'll put that information on your card as well. And then that little card will be your proof that you were vaccinated. And that way you have that if you ever get to a situation where there's some kind of an event going on and you need to prove that you were vaccinated to attend or what have you. That hasn't happened a lot yet, but there's a possibility. So definitely keep that card handy. Once you have it, it can help to take a picture of it with your phone so you have an extra, or scan it into a computer. If you need help with that, again, we're more than happy to help you. But definitely do not lose that card, especially once you've had both your doses. The Johnson & Johnson is only one dose, so obviously if you get that one, you'll just have the one thing on there and then you'll be good to go. It's also worth knowing that your second appointment will be at the same time of day as your first appointment. So if you get it in the morning, it'll be morning again. If it's afternoon, it'll be afternoon again, so on. And then we won't go into tremendous detail on all of these pages, but we do have a page on the phases of the vaccine distribution, which talks about the different phases where people are going to be made eligible as more vaccine is available. So if we click into that, we'll look at it for a moment. You can see that right now, phase 1A and 1B groups are being vaccinated, and this tells you who is included in that very specifically. So that's a very good way to know specifically. It says, 50 and older, first responder, support staff, so on down the line, sworn civilian personnel, corrections, school workers, in-person college faculty and essential in-person staff, so on, so on. It's a relatively long list. Then down here is a list of the comorbidities and underlying conditions. If you are over 16 and have a particular ailment, any of these, cancer, kidney disease, so on, then that would also qualify you for the vaccine during the current phase. That list is subject to change, of course, as time goes on. And then as the phases are updated, this information will change to indicate more people who are available and who are eligible, I should say, and what phases they're in. There's also information for the specific vaccination instructions here, which again is sort of what I went over on the other page. There's also more detail about the proofs of the acceptable proof of eligibility, depending on the reason that you are eligible. So you can read all the details there. And then these are the guiding principles that New York is operating their vaccine distribution process on: safety, effectiveness, expert approved, equitable and clinically driven distribution, transparency, use of data, privacy and patient safety, partnership, coordination, and public outreach, state leadership, and New York tough. We also have, there's a pharmacy partnership for long-term care programs so that the pharmacies can basically provide vaccines to people in long-term care facilities and nursing homes and other places where the people who are there generally can't go to the vaccine. It needs to be brought to them. It's really the same way they do it for the flu vaccine. It's not anything different. It's just a different vaccine. But the infrastructure and the process to do that already existed. And so they are working on that. And of course, this vaccination pilot program for people who are in the National Guard, they are also eligible and they can start getting the vaccine as well. We'll go back. So if you scroll up here, so the vaccine tracker, we'll take a look at this. And this mentions the specific details on the program when it started. You can see New York State's distribution plan for how they're planning to get it out. This is the progress to date. And it'll actually tell you this useful information. It'll say how many people have had at least one dose of the vaccine: 5,373,000. What percentage of the population is that? 26.9. The people who have completed the vaccine series, either 2 doses of Pfizer and Moderna or 1 dose of Johnson & Johnson, is about 2.8 million. And that's about 14% of the population. So that's pretty good. Given that the vaccine's only been around for a couple of months, that's pretty good numbers. And it also breaks all this information down by specific county. So if I wanted to scroll down here a little bit and look at Orange County right here, you can see that 81,000 people in Orange County have had at least one dose, and almost 40,000 people are fully vaccinated in our county. Pretty cool. And this also will tell you in the different areas how many total doses were administered by region of the state, how much of an increase that is over the past 7 days and over the past 24 hours. So, for example, if you look here, we're kind of down here in the southern tier.
I think we're mid-Hudson.
Are we mid-Hudson? Okay, I couldn't remember if we were just,
Yeah, I think we're mid-Hudson.
Okay, so in the mid-Hudson, then you can see about 500,000 people have gotten the vaccine in total, 83,000 in the last 7 days, and 10,000 just in the last 24 hours.
Mhm.
And again, the complete series, about half that number is completed at 26,000 in the last week and about 6,000 in the last 24 hours. So that means that of the 10,000 that got at least one dose in the last 24 hours, for 6,000 of those people, it was a second dose. So there you go. Wait, no, I'm misinterpreting those numbers. Yeah, so 10,000 people in total got at least one vaccine dose, and 6,000 people who already had one dose got a second dose. Yeah, there we go. All that information is here if you want to peruse that. And there's more data, including specifically for hospital workers, long-term care facilities, the demographic data, and you can even see the dosages allocated to New York State, as well as FAQ with useful information all about how the data is created, how often it's updated, and other questions people might have regarding that. If we look here real quick, we can see that the dosage allotted to New York State, according to the chart here. So you can see first doses versus second doses. So you can see the first week, which was the week of December 21st, they got about 500,000 doses there after receiving about 163,000 the week before. And you can see it steadily going up with a big drop the first week of March here. They got like 1 million doses and 300,000 second doses. So they, starting in March here, they're really picking up the numbers to get people vaccinated, and that's good. So all that information is there. We'll go back to the main COVID page here. And the last thing we really want to look at, which is kind of the big thing, is to check your eligibility. If you click that, it's going to take you into the Am I Eligible app. And this is going to help determine if you are eligible. These are a list of all the state-run vaccination sites, and it'll tell you what the name of the location is, what type of vaccine they're offering, where it is, and if they currently have available appointments. So as you can see, a lot of these ones have appointments. SUNY Corning, Rochester Dome, SUNY Binghamton, SUNY Oneonta, Potsdam, Plattsburgh Airport. All of these currently have available appointments. And then you can see there are some down here that do not currently have appointments. SUNY Albany, the Bronx, Medgar Evers College in Brooklyn, so on. And you can see that almost all the state sites are using the Pfizer vaccine. If you go to a state site, that's most likely the one you're going to get right now, although some of them have used Moderna in the past. It depends on what New York State is given by the federal government, effectively.
Hey, Baron, can you go that back to, I seen something about Middletown.
Yeah, there's SUNY
That's
Orange.
SUNY Orange,
Going
Mike.
too fast.
Yeah.
Sorry.
Yeah, SUNY Orange is the closest site to us, right in Middletown. They do not currently have appointments available according to this, but they are offering the vaccine. There is also not too far away a site, should be on here if I scroll down. Let me see. Should be here somewhere.
There's one in New Paltz.
There's one in
In
New Paltz.
Goshen. There's something in Goshen.
That's a county-run
But
one.
that's a county one, yeah.
We'll get to that in a moment. There is also a site at Marist College in Poughkeepsie is the one I was looking for, but that doesn't seem to be on here, so maybe that's not officially state-run. But there is one over in Poughkeepsie as well. And so now it's important to know, if you or someone you know is looking for a vaccine, don't generally take these no's at face value.
Yeah.
And the reason for that is because these no's are only updated like every 3 hours. So it's possible that appointments could go live and disappear, be taken up before this ever changes, and you would never know. So it's key that the no on this main screen here doesn't necessarily mean no, and to keep that in mind when you're looking. So once you've looked at these, it's also important to note, by the way, any of the ones with an asterisk here, on the two asterisks, they are restricted by residency. And if you don't live in the immediate area of those locations, such as the Guard Armory and Yonkers and Mount Vernon, the Kodak, Hawkeye parking lot in Rochester, York College, those are limited to only people who live in the immediate area of that location. So for here, you wouldn't be able to go there and get that at those locations. It's only people who are nearby.
Mhm.
And you can see the ones with an asterisk are the ones recently updated, if any. Let's see, anybody with a single asterisk? Let's see, double. No, not at the moment, but any, I know it's here that the list as a whole was last updated about, 22 minutes ago. And we'll probably update it again, given that at about 5 o'clock tonight, since it's about every 3 hours. So once you look at the list, you can click Get Started. And you can put in some information about yourself to determine your eligibility. It'll ask you for a date of birth, whether you live in New York State, and if so, your zip code. It'll ask you for your gender. It'll ask you if you work in the state of New York, because even if you don't live in the state of New York, if you work in the state of New York, you could be eligible, particularly if you're in one of those career fields that's on the eligible list. So it's important to know that you don't necessarily have to reside in New York to get the New York vaccine, depending on what you do. And then there's an acknowledgement basically saying this is for the sole purpose of determining eligibility. The disclosure of such information above is subject to the requirements of the New York State Internet Security and Privacy Act. They're not going to abuse the information you put in here. It's only to determine your eligibility, so on and so forth. And then when you go through here, it'll ask you more information. It'll ask, I'll just put mine in here for the sake of. And you can throw these in here. I live on the other side of the county, for anyone who doesn't know. And we can do this, and you say whether you have a comorbidity. I actually do, and so that's why I've actually already had my first dose of the vaccine. I'm scheduled to get my second one in another week or so. And so once you submit that information, then it will take you through, and you can locate providers, because it'll say, yes, if you are eligible, and it'll let you look at providers if it determines based on that page of information that you are eligible. If you're not eligible, it will say, sorry, you are not eligible at this time. Please, check back in when more phases are available. And then once you're eligible, you'll be able to see the locations here, and it'll use your zip code to find the ones closest to you that have available appointments. So in this case, Oneonta and Binghamton, it's showing us the two closest that have availability, and then kind of goes out from there to the crazy far away places. But then if you come down to the bottom here, like you see the Ulster Fairgrounds in New Paltz here, that has no appointments available currently. And it will tell you that there's no appointments available currently on this page as well. This tends to be a little more accurate than that first page in regards to having the update. But even if there's no appointments, you could still click this schedule your vaccine appointment button. And if you do that, it's still going to bring up the information page where you can, I won't do this part, but you can submit your information. It'll say no appointments available, but you can keep refreshing this page in your web browser, and it's entirely possible that an appointment might pop up, particularly if somebody cancels, then those appointments will kick in throughout the day, and you might be able to jump in and grab one and get it on there. Or if, especially if it's at the beginning of the day, if they happen to make a bunch of appointments at a site available, then that will be a good way to get in there. Obviously, I won't go any further on that because we can't, so we won't worry about that. But it will ask you for some further information once you've done all that. It'll ask you for your insurance. It'll ask you for, the standard address, phone number, email for contact, things like that. It'll ask you for some more details so that it has everything set up for you when you arrive, and it'll give you that confirmation I mentioned before. So that's how you check that for New York State. And that is, for all intents and purposes, how the New York State COVID website works. There we go. And there are links to any of that information I talked about. Safety, there's education. If you want to learn about the vaccine, there's a page for people who are providing the vaccine. All that information is here on the state website, and that's really a good central place to start if you're looking for a vaccine. Any questions about that before we move on?
I have a question about the vaccine.
Okay.
Is I know these companies are developed it, but where is it manufactured?
No, that's a very good question. Let's find out.
Anybody know?
I'm not sure.
Let's find out. Frequently asked questions. Let's see.
I don't know if Oh, I see.
Relevant. Let's see. The trials, the ingredients are listed here. Who were in the trials? Ingredients, availability. Let's see. I can tell you that generally speaking, they were not tested here. They were tested in other countries, but in terms of the actual development, I'm not entirely sure, but I bet we can find it.
Aaron, if you can pull up the fact sheet to the individual vaccine, the country of origin would be on that.
Okay, let's take a look. Let's take a look at Pfizer's then. Let's see. Give me a second. I have to end the screen share in order to share the document, so give me just a moment. So there's a document open here. We'll take a look. Come on, open up. There it is. There we go. Let's see. We'll go ahead and let me screen share that. We'll take a look. Then we'll go back. This guy, let's see. Share. Okay. So this is the fact sheet for the Pfizer one, emergency use authorization. It is worth keeping in mind, by the way, that the FDA has not traditionally approved these vaccines because there was not time. The FDA has given what's called a special emergency use authorization because from all the research currently available, the benefits of the given substance, in this case the vaccine, outweigh any potential risks, and there is emergency justification to distribute it to the people. So that is the status we're at with the vaccine right now.
Byron, I can tell you right now that is not the official fact sheet.
It's not?
No. I mean, that has the information it wants the public to see. But if you were to open a box of the vials, theoretically, there should be a fact sheet in there that would look like the map of the US.
Yeah, okay.
Information is extensive, and but that will probably
Right, let me just see.
give the average person what they would probably want to know.
Right, okay. Is that a thing? This hospital, other choices, card, additional information. Biotech, let's see.
Go back up. It's not impossible then. Germany.
Yeah, that's it. Biotech is in Germany, so they were at least partnered with a German company.
Mm.
It might have been produced there. Let's see.
If you, I don't know, but it would be in a current PDR because of the newness of this vaccine, and even probably a PDR. You'd probably have to go right to the company's webpage if you want to determine where it was being made.
Right, most likely. Let me see what this says here. Let's take a look. Time system. Okay, so let's see. It looks like they're shipping from sites in Kalamazoo and PERS, wherever that is. Let's see. PERS. Okay, so PERS is in Belgium. So there's Belgium and then Kalamazoo, of course, in Michigan. So I guess there's one in the U.S. and one in Belgium. And then they're also using existing distribution centers in Pleasant Prairie, Wisconsin, and in Germany. And they're designed to store product that's not going direct from Kalamazoo and PERS to the POU. So it sounds like manufacturing is either here in the US or in Belgium. And then they also have a facility in Germany that's distributing.
Well, that's for Pfizer.
Yeah,
Right.
that's specifically for the Pfizer, yeah.
Because I heard some was made in India.
That is possible. I can find out. Let's see. Useful information. Let me check this. Moderna vaccine name. Let's see what they have to say. Let's see. They have questions. Moderna, civilization. Where is the vaccine made? Moderna COVID-19 vaccine that is available in the United States is being produced by Moderna and manufacturing partners, including Lonza and Catalent at facilities located in the United States.
Well, that's made in the United States. Okay.
So they're making out in the United States, yeah. And then the other one, the Johnson & Johnson one, I'd have to double check. Let's see. Let's see what this says. Oh, we got the Johnson & Johnson vaccine existence. Let's see. Educational global collaborations for manufacturing. Okay, so the vaccine launch facility for Johnson & Johnson is in Leiden in the Netherlands. And then they collaborated with Biosolutions, which is Emergent Biosolutions, which is based in Maryland, Catalent, which is based in Indiana, and a number of other companies that are based here. Also, Rig Joffre in Spain, a Catalent facility in Italy, a biological e-limited facility in India, Aspen Pharmacare in South Africa, and Sanofi Pasteur in France. So they had a lot of partners in different countries that were helping to get it around. So yeah, the manufacturing is at the launch facility in the Netherlands, and then they're distributing it and getting it out from all these other sites, it sounds like. There we go. That's good information. Thanks for asking that question.
Thank you.
Yeah. All right. So we got all that. So that means. Oh, no, that's what I want. All right, so we're going to go over here. I'm going to close this out. I'm going to go ahead and put myself a screen share. We're going to do another screen share. We're going to go over here. All right. So this is the Orange County vaccine website. It's pretty easy to get to if you go to orangecountygov.com. And again, I'll put that in the description here. Put that in the chat and the chat as well for you guys. Let me just put a chat here. This is the website. It's the standard Orange County website, orangecountygov.com. And once you're here, they got some nice big buttons right here on the page, one for coronavirus information and one for the vaccine. So you're going to click that vaccine picture right there, and that's going to take you to the vaccine page. And once you're here, there's some information. Some of this is going to be similar to the same information that's on the state website. So for example, if you click this Get Started button here, that's going to route you to the same New York State eligibility app that I showed you a short time ago. So that'll take you to that same thing. You can also click this orange button here to get on the Orange County Vaccination Information Request List. And what that will do if you give that a click is it'll ask you to submit some information, and effectively they will contact you via text message, email, whatever they have, in order to let you know when vaccines are available in the county, usually in Goshen. They've been using Goshen as a main staging site for it, although they have done certain distributions in Newburgh and other places around as well. And it recommends that you continue to check that New York State Am I Eligible form that I showed you before, but that this will at least let you know what's going on a little more locally so that you can try to get in on that. If you are eligible and they have one available and they send you a message saying, hey, we hear you're eligible, it might include a link that you can fill out to then make an appointment. If you get one of those appointment links, you want to fill it out fast because other people are also trying to do it and those appointments will go. And it's standard information, name, address, phone number, email address, and then basic qualifying questions. Are you over age 50? And then do you qualify under the current distribution phases for any of the other reasons, career, comorbidities, things like that. And I also want to know if you've already gotten one dose. If you got one dose, but then something went wrong and you're trying to get a second dose, they want to know that to make sure that they give you the right dose and they have the proper information. Theoretically, if you got your first dose, you should have an appointment for the second. But if for some reason you missed your appointment for the second dose or something strange happened, they definitely want to know that when you're filling that out. And they do have reference links here for all of the COVID information from the state that we already looked at, as well as the phone number that I gave you. So that's all there. And then form will keep you in the loop for Orange County. And most counties around the area are doing these. Sullivan, Ulster, Dutchess, most of the other counties around have a similar form that you could use for those counties as well, if you go to their county website. Also here on the county website, there is the link over to that general New York State site that you looked at, the phase distribution lists, again, the Am I Eligible, all of that is in here. This is the to apply for the Medical Reserve Corps. And if you want to get in on that, that's basically, they're looking for people who are interested in learning medicine and might be able to help distribute the vaccine to those who need it, people who might be able to actually help with paperwork and give out the shots, because unfortunately, anybody who's doing that is a slightly higher risk because you're around so many people. So they're definitely always in need of people to help out with that. There's also a helpful list of links right here, so you can see the general COVID health information, just like that. And they have updates there. This is all information regarding the virus as a whole, not just the vaccine. So they have a whole page of COVID-related information. If you have economic struggles or need housing assistance because of pandemic shutdowns, losing your job, what have you, they have a list of what is and is not open per the governor's order, so you can keep track of where you can and cannot go and for how long and why. There's information on volunteering. Again, if you want to help out with the vaccine efforts, you could definitely do that. Particularly in local medical facilities and nursing homes, they could use help. And then there's, again, all the links and information regarding the Orange County government buildings, which are closed to the public, but you can reach them by phone, at least certain departments, if you still need service. Information about schools and childcare, regarding what schools are not allowed to do. There's memos to the superintendents and advice that they're trying to follow, and also the varying state education guidance for the schools is on there. There's frequently asked questions about, again, the virus as a whole, proper ways to wear masks, all the useful information you might need about the vaccine is here. They've got information on antibody testing. If you need to get an antibody test, you can find a location for that in Orange County and learn about how the test works and what that involves if you need to get a test. They have all the documents in Spanish and other really useful information. They also have information on county contact tracing, which they have been are desperately looking for people to work as contact tracers in order to help. If somebody is exposed and they find out, the county can provide that assistance to businesses or other organizations where somebody might have been exposed to help figure out who else was there and notify them that they might want to quarantine in the event they were exposed. And then, of course, that page for the vaccine, which we already looked at, which has pretty much the same information as the state, but also that great county sign up. So that's what the county site has. Now, real quick, the last thing I want to do is we'll take a look at one particular pharmacy in order to see what that pharmacy is doing. And like I mentioned, all the pharmacies, the process is basically the same. So we'll try Walgreens, for example. And you'll notice that they, again, much like all the other sites, have the COVID and vaccine stuff right on the main page, right when you go to their website. This is just walgreens.com. If you want to do riteaid.com, cvs.com, they're pretty much all going to have it right up on the top of the main page. And they're offering both tests. Both pharmacies are offering both COVID tests. If you need one, you can actually get it via drive-through, and of course the vaccine itself. What's worth noting is that the pharmacies have much more limited availability of the vaccine in terms of who is eligible. We can learn more on this, but last I checked, they were strictly limiting vaccine at the pharmacies to just people who met the requirement for age. People who, at the time I checked, were over the age of 60 and are now over the age of 50. They're trying to focus on getting seniors vaccinated specifically. So if you are somebody who's trying to get a vaccine because of your job or a comorbidity, you're probably not going to get a vaccine appointment from a pharmacy. This is mostly for seniors. And you can call them at the phone number here, 1-800-WALGREENS, or you can look for appointments online. And they've got all kinds of information on availability and eligibility, insights from their pharmacy experts, and even informative videos that will help explain in layman's terms the differences between the kinds of vaccines and how all that's working. Obviously, you guys have me for that, but in the event you wanted more info, there you go. And to go down here, this will tell you specifically in each state where you can get it. So if I click New York, for example, it's actually going to route you over to that same New York State page to determine your eligibility. So that will let you know, who or what is eligible. And it notes that, they're going to try to get into the general public when they can, but they're trying to focus on the specific eligibility right now. And if you do find appointments, it's pretty much going to ask you for the same information as that state form. It's going to ask you to check if you're eligible in your state, and then it's going to ask you to create an account if you don't have one, and then complete that same eligibility screening, which will help determine your eligibility and look for appointments in your area. So for example, if I do this, let's see if I do Florida, search. So there are no appointments within 25 miles of Florida.
Oh.
So Walgreens doesn't necessarily have a lot, but I know that CVS is in the area, did have some appointments, so that might be another place you can check. But the process is basically the same. You would put in your information, name, address, it'll ask you eligibility questions, and then it will try to locate you an appointment at a nearby pharmacy, wherever it has it available. But as I mentioned, the majority of the pharmacies were really focusing on seniors. They were not doing any vaccination for anybody with comorbidities or based on career. They were trying to strictly focus on seniors and allowing the state sites and, in some cases, the county sessions that were being set up, such as the pods in Goshen and other places, to focus on those with comorbidities or other health-related concerns. So that's kind of just a basic overview of the COVID vaccine websites. Again, I'll put all the links to the websites, and the information will be in the description of this YouTube video if you want to get more information there. Before we finish, are there any more questions about anything we've gone over today? No? Everybody's good? All right. Well, I thank you guys for joining me today, and I thank everybody at home watching this video. I hope it was informative. And if you do need more help or you have any questions, do feel free to contact us at the library. You can email us at fpl@rcls.org or just give us a call. And we will be more than happy to try to help you navigate this maze of websites and situations as best we can. And until next time, stay tuned for more videos here on our Florida Library YouTube page, and we'll see you next time.
Okay. Very
Barry.
thank you.
Thank you.
Very informative.